Sensitive content warning. I'm going to talk about COVID and male infertility. The short answer to this question looks like yes, and I'll show you the paper I just read on this. This is a 2023 paper on COVID infection in male reproductive toxicity, where the researchers were interested in looking into this because male reproductive system infection with COVID may be transmitted sexually according to some preliminary research, and other studies have shown hypogonadism, which is low sperm count, low sperm volume, and low T. So we know that COVID can cause sterility, inflammation of the testicles, and then injury to the testicle. The authors want to remind us that spermatogenesis is inhibited by any high body temperature, so this can be any inflammatory disease that could cause issues. However, with a COVID infection, the testicular inflammation and issues is a secondary result due to an adaptive response to the immune system. So in other words, these symptoms are due to the inflammation caused by COVID, not by COVID itself. COVID is causing this due to a secondary consequence. So to the point in question, ACE2 is known to be high prevalence in the testicles, especially in healthy individuals, with younger men having more ACE2 expression in their testes than older men. Additionally, fertile males have a higher level of ACE2 in their testes than infertile males, which underpins that younger males are going to have substantially more issues with their male reproductive organs because of this. So this endothelial dysfunction is systemic, meaning it can include the penile erectile tissue, which contains many blood vessels lined within that endothelium. And subjects who healed from symptomatic COVID infections then also required significant erectile dysfunction, where some people that had this issue underwent penile prosthetic surgery and they provided their penis tissue for the study. So when researchers were looking at these penises, doing histology and virology on it, they found that COVID-19 can persist in the human penis for a long time after the infection window, and that even in the acute phase, erectile dysfunction may persist due to COVID-caused cardiovascular consequences, such as those blood flow issues due to the microvascular blood clots that are formed, those fibrous blood clots, which could create hypoxia in the penis vascular structure. So the researchers here are suggesting that if you've had a COVID infection, it may affect your male fertility. So definitely go to your doctor and check after an infection to see if you are experiencing any infertility issues. So this is a weird statement in their article. I just want to bring attention to it. They say that there is little indication that COVID infections can negatively influence male fertility. However, if you're having low sperm count, low sperm volume, then your fertility is definitely going down. They're just trying to say here that it's not guaranteed you'll be completely infertile. That's sort of what they're saying here. It's just a weirdly phrased thing based off everything they showed above. And then they're saying that recent research indicates that COVID transmission via semen is extremely low. This, I think, is still up for debate and something that needs to be researched more because they didn't really show any papers or talk about this in detail in the study. So again, this is another off-basis statement that I'm not really sure where they're coming up with these for.